Hello, I'm Dr. Ann from Lydian Clinic. Today we are going to learn about adult stem cells which have amazing abilities inside our bodies. There are many different types of adult stem cells. Each type has a different role and is used differently in medical treatment. Let's take a closer look at the various and fascinating stem cells inside our body and their key characteristics. First, shall we take a look at the key characteristics of blood stem cells? Blood stem cells can differentiate into various types of cells such as red blood cells, white blood cells, and platelets. Red blood cells carry oxygen, white blood cells are responsible for immune responses, and platelets play an important role in blood clotting. They can replicate themselves to create identical stem cells. This plays a very important role in continuously supplying the blood cells our body needs. They are mainly used for blood diseases, for example leukemia or lymphoma. They are also used in treatment through transplantation for patients with certain immune deficiency conditions. These are often used in treatment through transplantation in patients. These are often used in healthy blood stem cells help replace and restore damaged blood cell production systems. This includes the process of recovery. Then how do we extract blood stem cells? Blood stem cells are a type of stem cells derived from a blood injection called PRP. They are a form that can be extracted relatively easily. Second, let's talk about bone marrow stem cells. Bone marrow stem cells include hematopoietic stem cells and bone marrow stromal stem cells. Hematopoietic stem cells are important cells that produce blood cells, including red blood cells, white blood cells, and platelets. They can differentiate into various blood cells. They are mainly used for blood diseases such as leukemia and lymphoma. Bone marrow stromal stem cells are different. They are widely used for cartilage damage, fractures, and tissue regeneration treatments. Bone marrow stem cells are mainly extracted from the hip area. This means if you touch the back of your hip, you can feel a hard, bony area sticking out. That area is called the posterior superior iliac spine, and we extract from there by making a small hole. It might sound a little scary, but in reality, we inject local anesthesia there first, and most patients do not feel significant pain during extraction. The stem cells extracted this way include hematopoietic stem cells, buckets, a certain amount of mesenchymal stem cells, and a large amount of cytokines and other regenerative components. Let me briefly explain the extraction process. From inside the posterior superior iliac spine, we collect bone marrow blood, usually from about 60 cEq up to 300 cc, depending on what is needed. The extracted bone marrow blood is then processed using centrifugation to separate plasma and blood cells. From this, we isolate only the stem cell layer to create a concentrated solution. Then this can be injected into the knee joint cavity, which is very commonly done nowadays, or injected into the bloodstream, or injected directly into blood vessels, depending on the treatment purpose.